Well, we begin in New York City this morning, where a measles outbreak has prompted a public health emergency. It's centered around an Orthodox Jewish community in Brooklyn, where more than 250 people have contracted the disease in the last 6 months. Residents who don't get vaccinated face fines of up to $1,000. An elderly New York man is in custody this morning for the killing of 2 young women nearly half a century ago. Lynn Sethlar and Janice Petropola were brutally murdered while vacationing in Virginia Beach in 1973. Police have arrested 80-year-old Ernest Brodnow. In his mid-30s at the time of the crime, Brodnow is now charged with 2 counts of murder and 1 charge of rape. Investigators aren't detailing exactly how they linked Brodnow to the crimes, only saying that they used advanced forensic technology. A 4.4 magnitude earthquake followed by a 3.5 magnitude quake shook residents about 100 miles south of Butte. The epicenter of Tuesday afternoon's quake was about 6 miles northeast of Lima. Officials say it was big enough that it was felt in parts of southwest Montana, but it was still a relatively minor event. It occurred along a fairly active fault called the Centennial Tectonic Belt. The last significant quake in the area was in 1983 with the 6.9 Bora Peak, Idaho quake. It resulted in 2 fatalities and caused significant damage. In Carbon County, authorities have released the identity of a man killed in a rollover crash near the Wyoming border and details behind the accident. 31-year-old Shane Bauer of Worland, Wyoming, died when his car went off the road and rolled on Highway 310 Monday. Montana Highway Patrol Trooper Andrew Barbera says Bauer's vehicle initially went off the right side of the road. Bauer overcorrected, crossed back over the road, overcorrected again, and then drove off the right-hand side of the road. The pickup truck rolled multiple times, ejecting Bauer. Trooper Barbera says Bauer was not wearing a seatbelt and speed is believed to be a factor. The Montana Department of Corrections is asking the public to be on the lookout for a female inmate who walked away from the Passages program. 37-year-old Sonia MacArthur reportedly left Passages at 11 o'clock Tuesday night. She's described as 5 feet 4 inches tall, weighing 140 pounds. She's serving a sentence for criminal mischief. If you see MacArthur, do not approach her, but call 911 immediately. She now faces an additional 10-year sentence for felony escape. The Billings Police Department is warning the public not to fall for the latest scam. Police say residents are receiving calls for donations from a group claiming to have purchased canines for the Billings Police Department. Police say do not give any personal or financial information out over the phone and to feel free to contact authorities if you have any doubts concerning solicitors claiming to support the police department. These calls, unfortunately, are almost impossible to trace.
So a lot of these scams are using voice over internet protocol phones, so you can't trace them. They're oftentimes out of state, maybe even out of country, so they're almost virtually impossible to trace.
Woolley also tells us ConocoPhillips, Shields, and a private citizen in the community have all provided money to help fund the police canines. Emergency responders across the Billings area were put to the test as they played out a scene of devastation in hopes of preparing for the worst. Both local hospitals and more than a dozen other emergency teams used an active shooter scenario. Q2's Jenny Fick got a unique perspective of the drill, volunteering as one of the many victims.
We're here to practice a mass casualty situation that would cause a significant influx of patients into our hospital, that some may be critically injured, and to test our capacity to handle that situation.
Volunteers were given cards describing various injuries. My character had suffered a gunshot wound to the abdomen and the thigh.
So you're not really able.
In some situations, such as the Vegas shooting tragedy, victims were arriving in numbers and not always in an emergency vehicle.
They show up in a private vehicle, they walk in, and so trying to recognize that, and then how do we activate our disaster system to get going.
Staff must be able to manage a large number of trauma victims incoming.
We really realized that we need to expand it outside the ER, into the hospital, move patients around, see what we can do, and really stress our systems.
This would be in addition to providing care to the already high level of patients in the hospital due to cold and flu season.
It goes all the way from the OR to the ICU to distribution, because we got to have extra equipment and beds. So it's absolutely a hospital-wide process.
This drill allows them to see what they need to change, what is working, as well as limit the emotional response in such a chaotic situation.
I just have a lot of confidence in the physicians and nurses and staff members that They'd be able to think through the process. Obviously, none of us would ever want this to happen, but we just want to be ready for our community and obviously provide compassionate care, but a very high level of care, even a very chaotic situation like today's.
As the first trauma victim to arrive until I made it up to the OR, it was less than 15 minutes, which proves just how truly important these drills are in preparation for a real emergency. In Billings, Jenny Fick, MTN News.
Thank you so much, Jenny. Montana and Wyoming Senators Steve Daines and John Barrasso are now resurrecting a bill to move a Washington state port forward that would handle coal from both states. Daines and Barrasso say their bill would prevent the Clean Water Act from being used as a weapon to block coal exports. Washington state officials cited the Clean Water Act when it denied a permit for the Millennium Bulk Terminal's coal dock in Longview, Washington 2 years ago. Developers of the Millennium Terminals hope to export 44 million tons of Powder River coal to markets in Asia through the Columbia River port. Daines and Barrasso introduced similar legislation last summer, but that effort stalled after a committee hearing. Senator Daines was also busy taking pharmacy executives to task, asking why Montanans are still struggling to pay for medication. Daines says a recent demand from a pharmacy benefit manager states that even if a drug manufacturer wanted to lower a medication price for patients, those manufacturers have to give nearly 2 years notice in order to make that change. Senator Daines said over that time that policy would prevent Montanans from saving roughly $8,000 per patient for cholesterol lowering medication.
Montanans can't afford to pay higher prices for 2 years for the sake of keeping industry happy and perhaps Wall Street. My question is, why does the company need to take more money out of the pockets of Montanans for nearly 2 years versus you doing your job to negotiate and lower costs for patients?
The CREATES Act is an act moving through Congress to help increase access and lower the cost of generic medicines. From the 66th session, while Montana lawmakers are deciding the big budget issues like Medicaid expansion, education, and infrastructure, our elected officials are working on plenty of other issues as well in the final 3 weeks. As MTN's Mike Dennison reports, one of those is whether and how Montana would legalize sports betting.
Last spring, the U.S. Supreme Court legalized sports betting nationwide, striking down a federal law that barred it in most states. Now, Montana is one of several states deciding whether to legalize it on a local level.
You could bet on anything from season-long championships to daily sports to actually in-game betting based on plays and so forth. And this is across the board from every sport from football to tennis to NASCAR.
State Senator Mark Blaisdell of Kalispell is sponsoring one of 2 bills to legalize sports betting in Montana. His would allow sportsbook operators to be licensed by the state and operate through kiosks at local taverns or other establishments that already have other legalized gambling.
For the taverns, it's an exciting thing for them to be able to have another addition of a way to bring people into their establishments, maybe a different form of customer that they traditionally don't have.
The other bill is from Democratic State Representative Ryan Lynch of Butte to allow the state lottery to arrange with its vendor to offer sports betting through machines also at existing casino outlets. Both Blaisdell and Lynch say the 2 forms can exist side by side and compete for business.
It's one of those things where it's another product that's offered through the lottery, and it's a thing that's happening already, and so we might as well capture the revenue and legalize it.
How much revenue? The state is only guessing at this point, but estimates that together the 2 proposals could bring in $2 million in annual tax revenue by 2021.
This isn't a big cash boom to the state because the payoff is so much higher than most other gambling activities.
Both bills are still alive and haven't faced much opposition so far.
I think it's an exciting time for Montana. There's a lot of different proposals that are being debated up here, and we'll see what comes out in the final days.
Reporting from Helena, Mike Dennison, MTN News.
Now we go to Missoula, where the city is making a move to become the first Montana city to step away from fossil fuels. Even with some mixed emotions during the public comment period, the city council unanimously voted this week to adopt a resolution to move the city's electricity to 100% clean, renewable sources by 2030. Those against the move say they are being forced down a path with only one option. However, council members argue it actually allows for more choices. Missoula gets most of its electricity from Northwestern Energy, which is also paving a long-term plan on how it produces energy.
The majority of our power comes from Northwest Energy, and right now Northwest Energy is trying to get a bill through the legislature that will allow them to buy another 150 megawatts of coal power. That is moving in the exact opposite direction of what this resolution is trying to address.
Missoula has now become one of 117 cities across the country to establish the 100% clean renewable energy plan. Flu activity is now on the decline across Montana. After a peak in mid-February, the number of flu cases reported has fallen each week. Still last week, more than 540 new cases were reported. The Department of Health and Human Services also reports in Montana 19 people have died from the flu this season. Only one Montana county has remained unaffected. Our neighbors to the east in Treasure County have not reported even one case this season. A new app is allowing Montanans to easily connect with their local health experts without even leaving their home. The Bright app provides a list of local health experts within your area. Users of the app can search and locate behavioral specialists, postpartum counselors, and gambling addiction specialists.
I know how difficult it is to find mental health services, and I just feel like we need an easy way to not just go to a primary care provider and ask for a referral, which is a great option, but to be able to take it in your hands and say, you know, my child is struggling with peer relationships or school issues, and be able to get a list of providers and make those phone calls myself too if I'm not really seeing the results that I need to.
And you can visit brightapp.org to get that app.